Welcome to this webinar, everybody, today. My name's Jamie Hunt. I'm the Head of Education at HCPC. And today we're going to be talking to you about some findings from our annual report, kind of particularly linking with the changing profile of education provision. So just a bit of housekeeping. So I've got a presentation, I've got a number of slides, and then we've got a Q&A session and a discussion session. Can I just ask that attendees just keep their mics off for the presentation session? Obviously, you can unmute yourself through the Q&A if you do want to ask any questions, but please, you can ask questions through the Q&A function or also the chat. And you can post those as we go, and we'll come back to them at the end. But I've got some slides to cover first that link in with our findings. So the agenda for today, we're going to just go through, I'm going to quickly summarise our education function, then we'll be focusing on the, I suppose, substantive piece, which is that kind of focus on the change of education provision, linked in with apprenticeships, diversity of education providers, and also the level of entry to the register. And then we have the opportunity for a Q&A discussion, and we then have some links to further reading and materials as well. So education function at the HCPC. We set and maintain education standards at the HCPC. Those standards are output focused to ensure those who complete programmes meet our requirements for registration. That's a statutory function of the HCPC to approve institutions and programmes against those standards. And we make decisions about the initial approval of providers and programmes against our standards. We then monitor data, intelligence information on an ongoing basis, and we ask education providers to engage with us at fixed points to reflect on the quality of their provision. The crucial point here is that on completion of approved programmes, individuals can apply to our register via our UK application route. We have four underpinning principles within our model, our quality assurance model that we run. Kind of, I suppose, as a headline now, we intend to be flexible, intelligent, and data-led in our quality assurance of institutions and programmes. We do that by focusing on the institution wherever we can, but we do undertake institution level and programme level assessments. We are flexible in what we do in our requirements, so we don't have a one-size-fits-all approach. We essentially try and apply the principles of right touch regulation and deliver essentially review the issue or the problem before jumping to a regulatory solution, and are flexible in the application of our model and kind of what we do to assess education providers. Like I mentioned, we review data and intelligence, and that's a key part of the evidence that we gather through regulatory processes. And we also have a four nations and regional approach, which means that we have members of my team that are responsible for nations and regions, and we understand those nations and regions. Somebody is off mute, so if you could just make sure you mute yourself, please. So we have a four nations regional approach where we become experts in those regions, and we can use what we understand of regions and nations to provide context through our assessments and our regulatory activities. Report on 22-23. This is so it's a two-year report. We do plan to produce something annually moving forward. It sets out a state of the nation for education and training in the 15 professions that we regulate, and our intention is that we focus on kind of key areas, I suppose, linked to our standards, but we want to be able to provide insight to our stakeholders about those key areas. That will include things like challenges faced by the sector, what's normal, what's best practice, and what we found from reviewing education and training programmes over the last couple of academic years. We want to enable really good conversations about those key areas and our key findings, anything that needs to change, and how education providers should approach specific areas. So this session is part of that, enabling that conversation, linked in with this kind of particular area that we're discussing today. And we expect the main audience of this session would be education providers, but from looking at the attendee list before, I can see that we do have a range of colleagues from different organisations too, and everybody's views are very welcome here today. So just a quick note on how we produced. So this is an evidence-based and factual report. It's based on our assessment of education providers and programmes in 21-22 and 22-23. And this is the first time that we've produced something like this. Our current education quality assurance model enables us to understand how education providers have met our standards and continue to develop. And our previous model didn't allow us to do that because of the way that we kind of structured our reports and our data. So this is, I suppose, an explicit aim of moving to our current model is being able to provide more insight. And the way that we've recorded what we have done and the findings that we've made has enabled us to do that, so we can provide some really useful insight to the sector. Okay, so moving on to the substantive piece. We're focusing today on the changing profile of education provision, and I have a couple of key points, I suppose, here. One is that the profile of education provision is changing, so there are more work-based routes, such as apprenticeships. There's more diversity in the types of education providers that we approve, and also professions are being delivered at different academic levels. And again, there is more diversity in different academic levels at and above the thresholds that we set for an academic level perspective. So drivers for that innovation are often linked to expanding the workforce. So things like the NHS long-term workforce plan in England, which I'll just come back to in a moment, and there being more market-driven routes as well. So I'm not going to talk through this slide in a load of detail, but I think lots of people refer to the NHS long-term workforce plan. What they mean is the NHS long-term workforce plan in England, which clearly is a key piece of work, and it's something that that we are very interested in at the HCPC. That plan has some lots of very ambitious intentions about expanding the workforce for the professions that we regulate and other professions. But I think it's really important to note that other UK nations also have plans in place. So there are plans in place across all 4 UK nations, and a recognition that expanding the workforce is needed to meet the needs of populations across the 4 nations. So I don't want us to be England focused when we're having these conversations, and actually, so I'm about to move on to talk about apprenticeships, but and particularly apprenticeships in England. But actually, a lot of the findings about apprenticeships in England can be really applicable to education providers in Northern Ireland, Scotland, and Wales when developing similar routes. And there are potential innovations in those 3 countries linked in with apprenticeship or earn and learn type routes too. So linking in with our standards here, diversification of routes is really compatible with our education standards. Those standards, as I've mentioned, are outcome focused, and they enable innovation. So they're certainly not meant to be stifling and should not be seen as stifling. We don't set inputs, and I've listed a few things that what I mean by inputs there. So we don't set the number of practice hours required through a training program. We don't set staff-student ratios or things like academic entry requirements. Now, that's not to say we're not interested in those things. Of course, we are interested in those things, but our standards essentially enable people who complete programs to meet our requirements for registration. So our standards of proficiency and our standards of conduct, performance and ethics. So we are asking education providers to consider how many practice hours they need to support an individual to meet our requirements for registration, what their staff-student ratio should be, and those are all linked in with our standards and how our standards are pitched and described from an output focused perspective. So of course you need to tell us what your practice hours will be, but then it's about justifying why those practice hours and the other kinds of areas will work to enable somebody to meet our requirements for registration at the end of a programme. So just, I suppose, a more specific England slide here, but there are specific aims in the NHS long-term workforce plan in England to develop apprenticeship routes. We've been approving apprenticeship programmes at the HCPC since 2017, so we're really well positioned to understand what some of the challenges are with apprenticeship provision, and also how education providers can overcome those challenges. And we've seen a real diversification of routes in the last couple of years. So the stats there, I'm not going to read all of the profession level stats, but 8 8% of approved programs are apprenticeship routes, but actually we saw almost a third of new programs approved over the last 2 academic years being apprenticeship programs. So the 8% will grow and keep growing, and that's our expectation. And about a third of education providers that propose new programs have proposed apprenticeship programs over the last 2 years, which is a significant increase in previous. So we're really seeing that diversification into more apprenticeship provision. And there are some challenges here, as I'm sure many of you are aware, and I've kind of listed these out and just wanted to talk to them for a few minutes. So certainly something we've seen is that there's these routes are fundamentally partnership arrangements between employers and education providers. And employers become different. Their role is different when through apprenticeship programs than it is with more traditional direct entry routes in higher education. That's because the employers, will do things like supply learners, and they'll have their own views, which are very important about how to deliver what they need to be delivered through an education program for their employees. We need to have a focus at HCPC, certainly though, on quality and ensuring that learners who complete programs are fit to practice against all of our standards, rather than being fit to practice for a specific role in employment. And those two things can be different. So we're not asking apprenticeship programs to deliver an employee for a particular setting from a regulatory perspective. We are asking apprenticeship programs to deliver somebody that meets all of our standards at a threshold level. A second challenge that I've noted here is about securing the resources required to develop apprenticeship programs. So clearly there'll be resources to deliver apprenticeship programs, but the development of them comes with, addressing these kinds of challenges. And like any new program, we'll need to be properly resourced from a development perspective. HCPC is one of the regulators involved in apprenticeship provision, but obviously there are multiple regulators, and they do sometimes have overlapping roles. An additional regulator to normal you would see would be Ofsted through new apprenticeship routes, and we certainly would like to dovetail in with other regulators, probably more than we're doing at the moment, and we have plans in place to be able to do that. We're really keen to reduce regulatory overlap and regulatory burden, and so we are picking up bits of work with other regulators to consider where we do and we don't need to kind of ask similar questions, and to be able to consider education programs in as I suppose right touch a way as possible. We do all have our own requirements, though, and our own reasons for existing, and those do need to be considered. There is also that there does need to be regulatory independence here as well. So the thing that I'd note here, if you have delivered apprenticeship provision or you are thinking of doing it and think, well, there's a lot of different bodies that need to look at this, the thing that I would say is we're not going to see an immediate change over the next 6 months or year perhaps, but the regulators that I've spoken to and that we're working with directly are really keen to be thinking about how we can reduce regulatory overlap. So there is a vision there. But then we need to define how we get to some of that vision. And my last point on this would just be that at HCPC, one of our aims of moving to our current model back in September 2021 was to reduce regulatory burden where we were in control of reducing that. We're doing a piece this year to just describe exactly what we've done over the last couple of years to reduce regulatory burden, but also to think about where it's within our gift, where we can reduce that regulatory burden further. So I want to try to reassure colleagues in the room that we are very aware that there are challenges in this area, and we are working to address those challenges internally and with other regulators too. But we also just need to be realistic about what that path looks like to reduction of regulatory burden. Practice-based learning capacity is another challenge here. And so practice learning capacity is a challenge not just in apprenticeship routes, but across the sector. And I suppose the thing that we have seen here is that some we've kind of heard both perspectives, actually, two different perspectives on this. One is that sometimes apprenticeship provision is preferred in terms of securing practice-based learning capacity because employers are delivering it's their employees that they need to kind of get through a program. And the other is that actually direct entry routes have preferred are preferred for practice-based learning capacity. The regulatory position here is that needs to be sufficient practice-based learning capacity for all learners, and clearly an education provider that's running different routes into regulation for the same profession will need to be thinking about those challenges across their whole provision and all of their future registrants for the professions that they're delivering. The thing that I'd say here is that it's really important that we think about where geographically new provision is established, where there are already significant challenges in practice-based learning capacity. Those might not be the most sensible places to spin up new programs. And at this time, we've not rejected approval because there isn't sufficient practice-based learning capacity. But there could be in the future a tipping point where we won't be able to approve new programs in particular regions or nations because there isn't enough practice-based learning capacity. Clearly, nobody wants to get to that. You don't want to put in a lot of work to develop a program to then have it rejected by the regulator because there isn't enough practice-based learning capacity. And there are innovations in practice-based learning capacity too, things like smart timetabling, things like broadening the range of kind of sectors and organisations that are involved in practice-based learning, simulation as part of practice-based learning too. But fundamentally, there is a ceiling for the number of available practice-based learning opportunities that need carefully considering by education providers within regions before expanding existing programs or developing new programs. And that sensible conversation needs to happen really across regions and nationally too. Academic staff workforce is another point here. So there are other kind of bodies that are also interested in this point. For example, the Council of Deans of Health. There is the academic staff workforce, and the profile of academic staff is that there's a large number of academic staff who are nearing retirement age. Clearly, with increases in learner numbers, more academic staff are needed. And again, there will be efficiencies in systems and things like smart timetabling, again, that could help with academic staff workforce. But again, fundamentally, there is kind of a ceiling on what's possible with efficiencies with existing workforce. So the throughput of new academic staff workforce is really important and something that education providers can influence. There are lots of challenges that are outside of education providers' control, and the HCPC doesn't propose solutions here. But I suppose the key point is that this is something that we will be looking at and very interested in with assessments against our standards, so that you have the academic staff workforce to be able to run all of the programs that you are intending with the number of learners that you're intending to. And the last point here is that education providers will need to support learners with different needs. So the thing that we've seen is, people that come into apprenticeship programs may be different to people that come into undergraduate direct entry routes. There are some people that will kind of could easily kind of apply to both types of route and may have similar, say, histories in education. So people that have just completed A levels, but actually what we may see more of and have seen more of is people coming through apprenticeship routes coming back to education. And also there's a point about, I suppose, pedagogy here and about how programs are set up, because fundamentally apprenticeship learners are based at their employer for the majority of their time, for 80% of their time. That means that they may see that employer as their home institution, and although they will be learning while at their employer, the actual direct contact time with the education provider will be less. And so, education providers need to consider how they can support learners with different needs based on the needs of the individual, but also the needs of the program and the model of delivery or models of delivery that are being proposed by an education provider. And I suppose that my last note here is that we have seen education providers overcome those challenges in line with our regulatory standards. Sometimes we've needed to point out problems and ask education providers to work on specific things, but we've not seen any kind of more fundamental issues that have resulted in us not approving programs based on these areas. They are challenges that education providers have been able to overcome, sometimes with the help of the regulator, but often sort of off their own backs and having considered these things through approval processes. So I will now move us on to talking about types of education providers. We at HCPC approve programs at higher education institutions, and that's the most of the programs and providers that we approve. But we also approve programs at many other types of organisations. So I've listed a couple there as private education providers and professional bodies. I've kind of grouped all of those into one here, but non-HEI providers account for 9% of our education providers. Only 2% of the programs that we approve, but those programs are often big. So it's 7% of learner capacity overall in the system. So clearly an important area really and type of provider that does lead to 7% of learner capacity in the system. And the thing that we picked up through our review in this annual report is that there are different approaches and challenges for education providers that are higher education institutions and also non-HEI providers. Also there are differences in influences and approaches within the 4 UK nations. There's somebody that isn't on mute, so if you could just make sure that you're on mute, please. That'd be really helpful. I can still hear somebody talking. So yeah, the point I was making is there are different influences and approaches in the UK nations, and that's because health, social care, and education are devolved matters across the UK. Like linking back to my point earlier about that we run a national and regional approach, we are aware of those differences and do ensure we are aware of them when considering context when approving new provision and reviewing existing provision. So HEI and non-HEI providers differences here. So there is that kind of clear split between approaches of HEIs and non-HEIs. The kind of the thing I suppose I picked out is that here our intention is never to disadvantage one group, and certainly we are doing work to think about how we can do better in that area. As a regulator, we do look to the structures of other organisations and how kind of sectors are set up, I suppose, to give us assurance. So within HEIs, there are clear utilised structures. Normally, there's a level of commonality across different education providers too. And linking to the point I was just making, external mechanisms and frameworks and standards are adhered to through requirements really by HEIs. So things like OFS requirements, they're being external examiners on programs. It is useful for us to understand those frameworks and understand that those frameworks are in place, well tested with HEI providers. Now, with non-HEIs, they may lack similar structures or have less rigid structures, and there's that point that there is less commonality across education providers. So for non-HEIs, when we start reviewing education provision, we are starting at a different point than if an established HEI comes to us and says we want to propose a new programme. That's not to mean that non-HEIs can't do it, but actually often non-HEIs need to work harder to show good performance. Saying that, our standards enable any education provider to run HCPC approved programs. I also mentioned a bit of work that we're doing to try and help non-HEIs, and one of the things that we're putting in place at the moment is linked into data. So There is lots of data available for HEIs, and much of it's public, and we use a lot of that data to inform our decision making. That data is not available for many of the non-HEIs that we approve, and so we're looking we're looking to establish a really clear mechanism that education providers can use to supply us with data, and to inform our assessments with that data, in kind of a structured way, but also ensuring that that data is really good quality. Okay, and the last kind of section here, really, for me, is about the threshold qualification for entry to the register, that level of qualification. So within our standards of education and training, we set out a normal level of qualification for programs leading to registration in each of the professions. That is based on that statement, and that threshold is based on what's needed for programs to deliver the standards of proficiency. So our standards of proficiency are pitched differently, depending on the profession, and things like level of autonomy, the different range of knowledge needed, for example, skills and experience needed within each professional area, which are by nature different. And I'll come on to how what that difference looks like in a moment. So we expect that most programs will be at or above that level, that threshold level, but realise that there are some exceptions. We use the word normally in our standards, and we also have some lines about equivalence to other qualifications. Fundamentally, the ask that we have is that education providers are able to design a program which leads to somebody meeting the SOPs, the standards of proficiency, and meets our sets. Standards of education and training. So programs can deliver a different level of qualification. That is possible, but it needs to be very clearly worked through, so that actually professional autonomy in each situation is where it needs to be by each individual that completes a program. Most education providers, I'll just move on to this slide here where I talk about this. So these are the qualification levels. You can see that most are at the bachelor's level with honours. Sorry, excuse me. One profession is below that. Some are at master's degrees, and then some are professional doctorates. So I'm not going to talk through that in a load of detail. What we have seen in this academic year is all but one program being proposed at, or these two academic years, sorry, all but one program proposed at or above the threshold level set out. But crucially, and I think this is an interesting finding, that about a third of programs were proposed above the set one level, so the levels as defined in the previous slide. And that is above the percentage of all programs delivered above that set one level. So all programs, it's about a quarter. New programs proposed in the last two academic year, it's about a third, which means that education providers are considering and continuing to diversify professional provision. That does stuff like, enable undergraduates, so people with undergraduate degrees to access professional training along shortened timeframes. Somebody might not want to go straight, back into undertaking a bachelor's degree if they already have one. We saw that was particularly prevalent in the OT and physio programs that were proposed. And there's, I suppose, a point here linked back actually to the difference between HEIs and non-HEIs, but all programs proposed at or above the threshold level were proposed by HEIs. And that's a really important point, because there is a marker there about the UK Quality Code, which where HEIs meet that the requirements which can ensure that they can deliver to that UK Quality Code. So we can be really confident that an HEI that's saying we're delivering a master's program is delivering a master's program, and similarly for a bachelor's level program, and we can take some assurance from what from the fact that they are an HEI, and are regulated as such by other organisations. That also links back to that point about regulatory overlap and us trying to rely on the judgments of others where we can. And there's just a slide here. This is my last slide actually before the Q&A, to just show where the kinds of the numbers that we saw over the last two academic years. So you can see there that most, apart from one program, were proposed at or above the threshold for the profession, and that there are some kind of bigger some different ratios there, I should say, to when looking at the proposals that go above that set one threshold. Now, further reading materials, we will send this to you, this slide deck, and we'll share the recording of this too. Give us a few days to do that, because we need to, our comms team need to sort of trim it down and make sure that it's all working and everything. There's a few further materials that you can read here. So the annual report itself, which is 147 pages, so you may not be able to read the whole thing, but there are, there is further insight in that annual report about this and many other areas too. We have a guide about responding to the NHS England long-term workforce plan. That guide, though, I think can be relevant to other home nations as well. That guide really sets out, I suppose, the 4 scenarios that we think education providers will be in developing their provision in line with the plan, and how to engage with the regulator on those 4 different scenarios. There's no link to the third one at the moment, but we're also just finalising an apprenticeships insight piece as well. I'm hoping we can supply that link when we supply the materials to you, and we just literally today finalised the PDF of that, so we should be able to post that on our website and link to it too. And there's a couple of bits kind of linked in with what we're talking about, the threshold level of entry to the register there, about because we increased that threshold for 2 of the professions that we regulate over the last few years. And so there's just, if you are interested in kind of looking at that and seeing the reasons for that, that it can explain that in a bit more detail too. You can kind of have a look there. This is the first webinar from our annual report. So we have 6 more. One is next week, and it's about program capacity, and then you'll see the other webinars there. We've invited lots of people to those, but please do share this link with other people that you think will be interested. So, we're particularly interested, I suppose, in getting people who are subject experts or leads for their organisation in the particular area. So, when we talk about interprofessional education, it'd be great to have people that are responsible for interprofessional education in the room at education providers and at other organisations, similar with things like EDI initiatives and service user and carer involvement. So, really keen for you to help, I suppose, and share the word with this. They are open access webinars. You just need to sign up to them to get the link. And then, with a couple of minutes to go, just a contact us slide and a thanks from me. So, I know I've done a lot of talking, but it's been a really kind of engaging session too. I think there's lots of food for thought for me and for others, for all of you, with links in with this kind of particular area. If you do have any kind of further queries, please try and speak primarily firstly to your regional lead. So I've kind of noted the members of my team there that are responsible for the different regions in England and the 4 UK nations as well. We have a main mailbox though, if you don't know who to contact as well. So get in touch with us. You can kind of talk through any new kind of professional provision, any concerns that you have, all those kinds of things, and we should be able to help you there. Davina, I've seen your hands up. Is there another comment that
just
you'd
a very
like
quick
to
question
make?
If we're
Sure.
unable to attend any of those other webinars,
Yeah.
will there be, because I'm interested in the one on the 21st but I can't attend it, do I need to register it to then have the link sent to me, or can I find them on the webpage?
No, so actually those links that are on there, we will post all of the materials on there, so that they'll be publicly available after this, and we will keep sharing this information too. So we have a regular newsletter that goes out, and there'll be ways of accessing it, and we'll kind of keep talking about them. We certainly don't want, I mean, the reason that we're doing this is we didn't want to produce a 150-page report and then have it sit on a shelf. We wanted to try and engage people with it, and I think that's been really sort of welcomed and valued so far. So yeah, that it's not just going to be kind of private recordings or anything for the people that attended. We will snip out the Q&A, actually, I should say as well. So we're not going to publish the Q&A. It'll just be my presentation bit at the start.
Thank you.
Okay. Thank you very much, everyone. It's 1 o'clock. I'll let you all go. Thank you so much for your attendance today. That's been incredibly helpful for us, and I hope for you too. So good to see you all, and likely I expect to see some of you at some of these other ones. Thank you.
Thank you.